Do you feel like you contributed to your child being autistic? Be it someone in the family or even yourself thinking that you have the traits? Or is there something else? Rates of autism diagnosis have tripled in the last 10 years, and there is lots of factors that they put it down to. For instance, more diagnostic availability, but also genetics. Now, you can pass down the gene, it could be genetic in the family, or you don't know anyone in the family, but you may have had problems in pregnancy. Research has recently shown that mothers that are pregnant that have IBD, for instance, ulcerative colitis or Crohn's, they then have a child that has autism. They tested, I think, 194,000 children. Now, I was diagnosed with ulcerative colitis. I've always had a bowel condition ever since I was a child. But when I was pregnant with my son, I was really poorly. I lost his twin at 7 weeks, and I was really poorly, and they thought it was just gastroenteritis. And I was then diagnosed with ulcerative colitis when I started losing quite a lot of blood. And for my son's pregnancy and my daughter's pregnancy, both of whom I went into labour very, very early and just had blood transfusions, steroid injections, and spent, most of it in hospital. I was very poorly, and both of those children are now autistic. My son diagnosed early on as a child, my daughter diagnosed in her early 20s. But according to research, this is quite a big thing that they are now finding out. So I would love to know what you think has caused your child to be diagnosed with autism. Do you think it's genetics? Did you have problems in pregnancy or outside factors? Please pop it in the comments. I would love to know. And if you do need any support, as always, my group on Facebook, December Rose Coaching, is December Rose's Empowerment Hub.